So this is the card for nurses, and there's another card for doctors, which I'll send you. But we will. Okay. Now what I asked, there are 5 students. Okay. I want to ask you a question here. So, shall we learn some sentences, quality sentences, or B, shall we do one role play each? So, learning, number one. Number one is learning. Number two, practice. Learning, practice. So here, learning, practice. A, students. Or B, B, teacher. So all the things are same here. Okay. So you want to participate, you want to learn, or you want to do one role play. So that's what you have to see. So we learn 12 sentences. We learn 12 sentences. 12 quality sentences. So we'll take 30 minutes for this. 30 minutes for this. Afterwards, role plays. What do you say? Are you okay with this supposition? Yeah. Are you okay with this supposition? Yeah. 12 sentences we learn today. Yeah. Right. Okay. There we are now. Okay. So all are ready to learn. Fine. Yes. Yeah. Right. Now, communication skills. Communication skills. Okay. We are going to learn about communication skills. First one, what are? So this will be for 30 minutes. Afterwards, we'll do the role plays. For the exams going students, will take first, then afterwards the others. So if there is any exam going students, so message me so that I can make a note. Message me personally on my WhatsApp. Right. Communication skills. So let us see what are communication skills. Number one is eliciting information. Eliciting information. Number two, seeking clarification. Number three, explaining the providing explanation. Number four, offering reassurance. Number five, providing advice. Number six, adapting or adjustment, adapting speech styles. Now, these are the 6 different things which are very, very important. Now, what is eliciting information? Eliciting information means, for example, in the beginning, you will say, you already have the role play card, you already have the case notes, you have the role play card. Oh, sorry. Yeah. So, when you say eliciting information, so elicit means you are getting information, gathering information of two things. You know some things, you want to confirm. And second thing, you don't know some things, you will know. So eliciting information is two-way beneficial. One is, whatever you know, that is right or not, he will tell you. Or whether you misunderstood, he will tell you. Number two, whatever you don't know, some additional information, he will tell you. Okay, he'll tell you about his feelings. Okay, feelings will not be written anywhere, right? So he'll explain in detail. So these are the two things. This is the way how you will know about the patient's condition. Okay, then next one, seeking a clarification. Now, what do you mean by seeking clarification? For example, he says like this: I do not want to take insulin injections. I do not want to take insulin injections. Now you'll ask a question. You're asking him clarification. You're asking him for a clarification because you don't know why he's rejecting, why he's refusing insulin injections. He says, I don't want. I'm not interested. So you're asking for clarification because you're not clear. You don't have any idea why he's rejecting. What's the background reason for rejection? So asking for reasons On what basis are you rejecting insulin injections? I'm afraid of insulin injections. I'm afraid of injections. I'm scared of taking injections on my own. How is that possible? If I take injections, if anything goes wrong, then I'll face difficulties. I don't want to take the risk. So you are seeking clarification. Why? On what basis? On what grounds? He's rejecting insulin injections. Okay. Yeah, in between, I'll ask you some questions. Okay. Do you think, okay, do you think that we are on the right track? Respond, please. Respond, please. What do you think? Are we on the right track? Or am I wasting your time? Or we really need this information? Or this you can manage on your own? So we can exclude these parts in the speaking. What do you think? Give your comments here. I'm focusing this on the exam going students. So this will be beneficial for everyone. Sumesh, going on? Yeah. So, right. So, providing explanation. Now, first you are eliciting information. So, why do you want to take insulin? What is the reason for coming here? You already know because you're mentally prepared. But still you ask him, what is the reason for coming here? Okay. Then he will tell you, I have been diabetic for quite some years, but I have been managing very well. But last week, I had given my blood tests. And in those blood tests, the doctor has noticed something. So all these things he will tell you. Already know these things. You already know these things. So this is the point. This is the point. But still, you ask the patient to tell him in his own words. Okay. The patient, when you elicit information, the patient will confirm what you already know. This is number one. Okay. The patient will confirm what you already know. Okay. Next one. the patient will provide you the information you may not know. Okay. The patient will confirm what you already know based on the case notes. The patient will provide you the information you may not know on your own. And then the patient will share his personal feelings with you openly. So these are the three things, because he will not share otherwise. So when you elicit information, okay. So now he'll share these points. Right. Next is seeking clarification. Seeking clarification. What do you seek clarification? For example, the patient is reluctant. Reluctant patient. Okay. Or the patient is, this is a very special thing. Reluctant patient or adamant patient or confused patient. Confused patient. So if the patient is reluctant, okay, if the patient is reluctant, then he will tell you, if you ask him, he will tell you, he'll say, I don't want. He'll say, I don't want. I don't want to take insulin injections. Then what you will do? How will you handle this situation? So you ask him why he is reluctant. Why he is reluctant. That means you will get the information, the reasons. He'll provide you, the patient will provide you the reasons why he is not interested. The patient will provide you the reasons why he is not interested. Adamant patient. Okay. Adamant patient. Okay. So reluctant patient has some psychological problem. Adamant patient is a different style. Okay. Adamant. Okay. He already reluctant patient because of fear. Adamant patient because he doesn't want to do. He himself doesn't want to do. Okay. Right. So reluctant patient is not interested because he's afraid, maybe. Okay. Frightened patient. All different labels you can give. Then whatever you can say there. Okay. He will express his disinterest or lack of interest and distrust in the disinterest and distrust in the procedure, maybe. Right. Confused patient. He has mixed feelings. He has mixed feelings. Okay. He has mixed feelings. Okay. Doubtful, full of doubts. Full of doubts. So he will share with you all these doubts. Okay. Then you will ask him, why do you think, I don't think this is beneficial for me? Why? On what grounds do you think this is not beneficial? Okay. Why do you feel that this is not useful for you? So if you ask like that questions, he will tell the reasons behind that. Then you can give the answer to him. That means you will solve. He has a particular problem. That problem you have to solve first. Okay. When he says, I'm confused, I don't know whether my aunt had this, she has medical problems, so she, okay. So the next one is scared or frightened patient. Frightened patient. Okay. He has a fear. Has a fear based on the family history. Based on the family history. Okay, based on the family history. Based on the family history. So then you can tell, first of all, you should know whether he's a reluctant patient or an adamant patient or a confused patient or a frightened patient. Based on that one, you will respond. Okay. So first find out why he does not want. Okay. Why he is frightened. Right. Then based on that, he wants some information. What all information you give, he will not be ready to listen. He wants a particular information, a piece of information that you have to provide. So ask what exactly he wants. Let him open up. The next one. So first one, you will elicit information. Then based on that one, you'll ask a clarification. Then you will provide an explanation. Okay. Now, he will give his reason why he is adamant, why he is confused, or why he is patient, why he is reluctant. Okay. When he gives the reason, then you can provide the explanation. What explanation can you provide? Okay. What explanation you can provide? No, your reasons, your concerns. Okay. Your concerns are quite reasonable. So now you're giving an explanation. Okay. Your concerns are quite reasonable. Okay. Your concerns are quite reasonable. Oof. So provide explanation. How do you give explanation? How do you give explanation? That is very important. Okay. So explain what is right. Then explain what is wrong. Okay. And you have to explain what is right, what is wrong. Okay. So he has given his clarification. Some things may be right, some things may be wrong. So tell him this is right. Your concerns are reasonable. That is right. Anybody will react in the same way. That is right. Then what is wrong? That you tell next. But as a nurse, I can tell you something. This is not the absolute truth. I have seen many patients, okay, who have taken these insulin injections and are able to lead a very good life. Okay. So it is everything fine. So then how can he manage the condition? How can he manage the condition? These are the three things. What is right? Some points may be right. What he told, some of the information, what he told is right. I am worried. Yes, his worry is right. His concerns are right. His concerns are reasonable. He's a human being. First time he is facing this problem. So he will worry. Na? So that is right. Worry is right. Confusion is right. So tell him your concerns are reasonable. This is how many people react when they face this situation for the first time. Okay. Now what is wrong? With regard to you, this is right. But with regard to insulin injections, the truth is different. Okay. The truth is different. If you're compliant with the injections, you can lead a normal life. There is nothing to worry. So now the next one, fourth one. Yeah. Next, fourth one, offering reassurance. Offering reassurance. How do you give reassurance? Never use the word I reassure you. Reassurance means something very high. What is reassurance? Do you know? Many people say the word I reassure you. That's it. I am reassuring you. I reassure you. This is a very big mistake. This is a very big mistake. I reassure you is a very big mistake. Actually, you did not understand the meaning of this word reassure. Now I'm going to show you this word. It's a very powerful word. Reassure. It's a C1 vocabulary. Or reassurance is C2 vocabulary. How will you know the meaning of this word? First of all, it is C2 vocabulary. If you know this meaning, this is C2 vocabulary is for A grade. If you know this word, that means your knowledge is A grade. Just saying, I reassure you, doesn't mean, so when you say, I reassure you, that means you are a man of words. You're a man of words. Provide reassurance. This is right. This is right. Okay. That means you are a man of deeds. You're just telling, I reassure you. That doesn't help you. That doesn't help him. But if you provide reassurance, you are a man of deeds, man of actions, not just words. Man of deeds. Deeds means man of actions. Now, what is man of words? What is man of deeds? If you say, I reassure you, you are using the word reassure. Reassure is not just a word. Reassure is not just using a word. Okay? You're not. Now, provide reassurance. That means you have to give words of advice, you have to give words of comfort, and you have to make him feel less worried. I hope you understand now. Okay. So this is the point here. You have to provide reassurance. The meaning of reassurance is this. Reassurance is equal to this. Reassurance is this. Okay. Reassurance is this. So providing reassurance means providing reassurance is equal to this. That means take the word provide and take these words. So if you are providing reassurance, that means you are providing words of advice, you are providing words of comfort, and you are making someone feel less worried. Now you understand what is reassurance. I reassure you, man of words or a woman of words, just telling, I reassure you. But how are you going to reassure, provide reassurance? How are you providing reassurance? Okay. How are you making him comfortable? How are you making him feel less worried? Bring his worry down. Okay. If you use those words, then words of advice. What are the words of advice? Give him. Then he himself will be reassured. You cannot reassure him. He himself will be reassured. Make him comfortable. Give him words which comfort him. Tell him, my aunt is also diabetic. She has been diabetic for the last 12 years. She has been on insulin injections for the last 5 years. She has no problem. But once she stopped taking insulin injections and she had a problem and things became a little complicated and she had to approach the doctor. Then doctor said, are you compliant with the insulin injections? She said, doctor, I'm sorry, I thought everything is fine, so I temporarily stopped for 3 or 4 days. Yes, this is the result of your non-compliance with medication, insulin injections. Until you took the insulin injections, you are fine. So continue the same thing and you will not face any difficult situations. From that time onwards, my aunt was 100% compliant, absolute compliance with medication. And never again in her life she encountered any complications or difficulties. This is a real example I'm telling you. I have seen my aunt happy. Only the thing is, she's taking insulin injections. Now she got used to it. Automatically she will take. And there are many more examples like this. All these people are leading a wonderful life. So, if you follow the regulations and recommendations and take the insulin injections on a regular basis, you will have no difficulty, as my aunt and many other patients. So this is the way how you can comfort the patient. Oh, okay. He will feel less worried now. Earlier, first time, na? He doesn't know anything. But when you are experienced and you are telling, okay, this is the way how you can discuss. I have another patient of mine. He was facing the same situation. In the beginning, he also reacted like how you reacted. But I convinced him and I explained him everything like how I'm going to convince you now. He understood the importance of insulin injections and he was compliant with the medication regimen from day one. Until now, he is very happy. He's leading any normal life like any other individual. The only difference is he's taking insulin injections and nobody knows all these things also. That is his problem he's taking. Why should anybody know? Other than that, he's common. So if you also are compliant with medication regimen, you also will be wonderful. Okay. Everything will be same. Only one addition and the change in your routine is taking insulin injections on a daily basis. If that is done, then you are fine. Where is the need for worry? Nothing will bother you. You'll be perfectly fine. These are the words of reassurance. Okay. People don't know what is reassurance. Okay. Are we together? What do you mean by this? Are we together means? Do you understand what I am telling? Is it meaningful? Or am I teaching French, Latin, and German, which you don't want and you don't understand? So everything is clear, I suppose. Just give a yes if you feel that what we are doing is useful for you, so that other points also we can discuss. There are 2 yeses. Come on, take 10 seconds. Yeah. What about others? Do you think it is not useful? Should we stop? Because now I'm going to give you sentences. Already I gave you some. Yeah. So there are some students who feel that this is useful. So we'll carry on. And providing advice. Providing advice. Okay. Now you can tell him what is good for him. Okay. Continue. What is bad for him? Okay. So what will improve his condition? What will improve his condition? Okay. What is good for him? Simple words. Okay. What is good for him? What is bad for him? What hinders the progress? What is bad for him? So avoid. Okay. What is good for him? Continue. What is bad for him? Avoid. Okay. Any further doubts? Okay. Refer to the doctor. Refer to the doctor. That's it. If you know, ask him, it is good, ask him to continue. If you know that it is bad for him, ask him to avoid, discontinue that. And if he has any further doubts, if you don't know, okay, beyond your reason, then refer to the doctor. Now, adapting teaching styles. Now, is he the patient? The patient is old. The patient is old. Okay. The patient is old. Then you have to be kind. Be kind. Okay. Patient is worried. Patient is worried. Be sympathetic. Okay. Right. Patient is reluctant. Patient is reluctant. Be friendly. Be friendly. He's not interested. You try to be friendly with him. Okay. So then patient is a child. Patient is a child. Be gentle. Be gentle. So according to the patient, you have to, okay. According to the patient, you have to adapt your speech styles. You should not be very bossy, like a boss. I know everything, you listen to me. That's not the style. That's not the style. Okay. And age groups, you can see older age. According to the psychology of the patient, you have to relate. So, yeah. Now, we have learned 6 points. 6 points regarding communication skills. Okay. Communication skills. We had 6 points. We had 6 points of communication skills. Right. Were these points useful? To what extent? 0 to 100%. So we'll go to the next point now. We'll go to the next point now. Yeah, please. We are giving. Just to tell me if we are going in the right track, if these sentences are what, these things which we are learning are important. Yeah. So Sandhya, Kunjumon, Simran, Mahesh. So they feel that this is important. Okay. What about the others? Yeah. Yes. So these are communication skills. Fine. These points I am writing and I am posting in the Telegram channel. Okay. Right. Already posted there. Now we are going to the next point. Now we are going to learn some sentences, 12 sentences. So 12 quality sentences. Okay. Or you can say responses. 1. Okay. Okay. I'm giving you some sentences here. Rate on pain 1 can 10 your scale you a of 2. Can you make this into one sentence? Can you make this rate on pain 1 can 10 your scale UA of 2? Can you make it a sentence, please?
Sir, on a scale of 10,
Can you type, all of you? Can you type, all of you? Yeah, this is one sentence. So write down your sentences. How you want to, you can add or reduce, but this sentence is very important. Next, ongoing, any conditions have you medical do? Yeah. So second question, before writing your answer, write the number also. Number 1, number 2, like that one. Simran, one word is missing. Okay. These sentences, use them as it is without changing them. Okay. Been, you, hospitalized, have, ever. These words you should not change, okay? Like this only you have to write. Number 4. Me, mind, bothering, would, telling, would, me, mind, bothering, would, telling, would, you, what's, me, mind, bothering, would, telling, would, you, what's. family A has had heart stroke. Anyone your attack in or yeah, this is the next one. Fifth point. Family A has had heart stroke. Anyone your attack in or then number 6. Taking long been medication have this how you question mark in your family anyone had not anyone has anyone had yeah, write down the question number also. Yeah, has anyone in your family had a heart attack or a stroke? Good. Bless you little. Next, 7th one. Situation how current do you manage? Eighth one. Of you work do type of you work do type what do question mark. Number 9. Exacerbates symptoms is your there that anything 10 ever any had have ever any had have the past in you surgery. These are the 10 sentences. Okay. So these sentences you can write and you can put. Now I'll be calling you for individual speaking sessions after some time. So those who are going for examinations, you can message me personally. Okay, those who are ready for the sessions. Fine. I'll give you the card for the nurses and the doctors. Okay. And I'll be calling you personally. The morning session is done and I'll be taking personal sessions